Hi, ladies. So I'm so excited that you're all here. So welcome to the Masterclass Feel Like Yourself Again and what's happening after your 35s and why it matters and what to do next. So I just want you to share like how old are you or what you expect from this masterclass. I'm Dr. Viviana. For the ones that I don't know me, I'm a mom of three beautiful, energetic boys. I'm a family physician. I was born in Colombia. I'm now based in Curacao. I did my specialization as a family physician in the Netherlands. And I'm focusing right now a lot on functional medicine and hormonal health. This has become because after my third pregnancy, I wasn't able to lose the weight. This was around my 38 years old. I'm now 42. So what happened is like I dove in, okay, what does the hormonal health mean and what happens in this phase of life, right? Because during my specialization, I did get some training in the menopause, but this was like one lesson. So it's not enough. And also because I'm focusing a lot in what people are going through, let me admit someone, yes, that people are going through in this phase, then I just wanted to dive deeper in lifestyle, in nutrition, and other integrative therapies. Sometimes I even use homeopathy or other things, but I like to focus also in how we can prevent diseases. So that's why I love doing these master classes and why I'm doing these teachings. So welcome, you're in the right place. And whether you're joining from Curacao, the Netherlands, or anywhere in the world, I'm so glad that you are here. So before we dive in, if you have any questions, please drop them in the chat. I will answer them at the end because then we will have the Q&A. For the ones that have the workbook, I will tell you when to use it. And if you don't have the workbook, you can just screenshot the slides that matter, right? So let's dive in. And before I continue, I would just like to know why you are here and what you expect from this presentation. Sorry. I have to, yes. So, the map for today. So we will be talking about your hormones. Oh, sorry, I'm so sorry. So today we're talking about four things of your hormones, your symptoms, how the full picture, and how your next 40 years could become. Because how I see it, this around 35, 40 years is our golden point. I will explain more of this later, but just for you to have an idea how this presentation is going. It's not about taking notes. I will just want you to understand and ask the questions when it's needed, right? So the first step, your hormones. What's actually happening inside your body? So the first thing to understand is how these hormonal changes start. We all think, or a lot of people think, that there are around, excuse me, there are people joining and it's not going well. I don't understand why. Is everyone listening? Can someone react with a thumb or something in the chat, please? So I can know that you all are hearing me. Thank you. Thank you. Okay, so you're all listening and there's someone joining, but it's not going, but I will try to continue. Okay, so what happens in this phase of perimenopause? The hormones began to shift, right? And we think, okay, this is around your 50s, 51 that you hear, okay, this is menopause. But actually, these changes start way earlier. And this is because the amount of follicles that we have in our body we have an amount from birth. So, and we begin to lose them with every cycle. With every cycle, we lose some follicles and some eggs. And what happens with this eggs? So this person is that when they become too lower, then the amount of estradiol or progesterone, our hormones are important for our body. I don't want you to understand all of this, but this is for you to understand a little bit of what's happening. They will be causing a lot of the symptoms, right? So after what we see here around for 50, for 51, a lot of people go through some hormonal changes, but years before, you see that there are already some changes happening, right? So what you see here is like all the hormones that play a role in this phase. Not all the hormones, but the most important ones. And what you see is how the estrogen becomes higher at the ovulation. This is the moment of the ovulation, and the progesterone becomes higher, preparing for the egg to come, right? So all the hormones fluctuate a lot during the month. And what I'll be focusing right now is the three hormones that I find really important in this phase, because when one shifts, all the three other ones will respond. So this is what we see with the progesterone. When you saw the progesterone was, sorry, I need people coming. So progesterone is the one that declines. When you look at the graph, you saw how it was the ones that were declining was progesterone and estrogen, right? So the first one is progesterone, and this is your calming hormone. It can disrupt your sleep when it's lower, and you can be more anxious. And probably this is one of the first symptoms that most women feel, but then they don't recognize it as a hormonal shift, because we think most of the times, oh no, this is more about the hot flashes or my menstruation that is not regular. And there's ones are actually symptoms are becoming afterwards, not at this moment. The other one is estrogen. It fluctuates a lot during this period. It doesn't simply disappear. So it swings, it's one day high, the other day low, and that instability affects your brain, your metabolism, your bones, your joints, your skin, your mood. And that's why sometimes we go a little bit crazy. And the other one is cortisol, and it becomes harder to regulate. Cortisol is your stress hormone. And when the other shift, it will influence also how cortisol is regulated. And this can drive that you will get a bigger belly, or that you have more afternoon crashes, or that you are wired and tired. And what I mean with this is like at the end of the day that you're so tired, but you just can't relax to sleep like you wanted to. So let's dive a little bit deeper in what progesterone and what it means for our body. So what you see in this graph is how the hormones are shifting, right? And you see here like the progesterone, that's the blue one line, it becomes lower. And for your body, it recognizes it like estradiol is still higher. So, and this decline is why the sleep and anxiety are often the first things to change, even before the periods becomes irregular or other symptoms appear. So the first symptoms to appear here are waking up at 3 a.m. or feeling anxious for no reason, or that your sleep is lighter, less restorative, so that when you wake up, you feel tired. So these could be signs of progesterone that is becoming lower. The other hormone was estrogen, and estrogen fluctuates a lot. So you see here when the moment of the first menstruation, it's at the beginning it's a little bit irregular, and that's why kids at that moment are a little bit cranky. But after I think 20, it becomes more regular, and you see that this amount, you don't have that many symptoms. Of course, there are some women that have more symptoms during the menstruation, but it also depends on other factors. So in the perimenopause, you see that it becomes lower, but it becomes lower more with peaks, not like the progesterone that it was more steady. And estrogen is in everything. So it will influence your brain, how you're thinking. Sometimes then you have like a brain fog, and brain fog is that you're thinking about something and then you just think about what you forgot the exact word that you wanted to say. Your bones, if you don't take action, then your bones will will be influenced, and you will have a higher chance of osteoporosis. And this is more at the end. It's not really at the beginning of these hormonal changes, but there are things to take into account. Your heart will be influenced. What we see is that in women after the menopause, and the menopause is one day that you won't get your menstruation after 1 year without using any contraceptives, then your the risk of getting a heart disease is become higher because the estrogen is not there anymore. Estrogen protects our heart. Also, metabolism is influenced, how the insulin resistance is influenced, and our skin, it becomes drier. Even our vagina can become dry, or mood shifts, or joints begin to feel more pain, and the sleep becomes more influenced because of the influence of estrogen also. What happens with cortisol? Because it's harder to regulate. So just for you to understand, the cortisol is regulated by the hypothalamic pituitary adrenal axis, so the HPA axis. And I just want you to understand the brain and some part of your kidneys are making sure that cortisol is produced or not produced. That's the only thing that I want you to remember. And how stress influences the hormonal imbalances. So if you have already a low estrogen, this will cause this will reduce the regulation on your brain, and the cortisol can become higher. But if your progesterone, the thirst hormone, is low, then you have more mood swings and the sleep problems and the hot flashes. So regulating stress is a really, really important part to feel better. So what happens when we don't do that? We see like women get more belly weight, especially around your belly, and drive central fat accumulation when it's chronically elevated, or you can have stretch marks. It can also sorry, it flipped. It can also cause energy crashes because it disrupts the sugar regulation. So I don't know if you recognize it, but I'm pretty sure you do. Like at 3 p.m., you really want that chocolate. Or this is one of the signs, and it's because of the regulation of blood sugar is not correctly. And the other is you're wired but tired. So you're alert in the evening, but exhausted in the morning. This is a problem also with cortisol and how to regulate it better. So one shift starts a whole chain, a reaction. The first one, your progesterone drops. Then causes sleep disruption. Then it can causes the cortisol rises. Then it can causes the blood sugar that fluctuates. And then your energy and mood can become destabilized. So this is why perimenopause, and perimenopause is the years before the menopause. So, and this can start 10 years before the last menstruation, feels like everything is happening at once, because hormonally it is all happening at once. So if you are around 40, you may already feeling these changes. So what we will see in this process of the hormone, this is a transition, not a moment like we used to think, at least when I hear some patients. Menopause is just one day, right? That's 12 months without a period. The perimenopause is this period where the estrogen begins to fluctuate. And for some women, it can be 35. For some women, it can be a little bit later. But in my eyes, after our 40s, we all are going through this, because most of the women go through menopause around their 50s. Afro-Caribbean woman, 49, from a research in the US, and a woman from India, even 45. So it really depends. For example, I have two aunts that they got it with 42, so that's really young. That means that they could already having some symptoms when they were 32. So what happens after in the postmenopause? That is the phase after that one day that you didn't get any menstruation for 1 year. The estrogen production is almost out. There's some production yet, but it's not comparable to what it was before. So some things to consider, because some women need a different lens. If you had your uterus removed and your ovaries are still there, you can track your perimenopause through your symptoms instead with your periods, right? And even if you still have your uterus, you maybe, for example, in the perimenopause, the first symptoms is the sleep problem, right? So you can track your symptoms before the menstruations or your period is going away. Some women get an operation and they hysterectomy, so the uterus removed with the ovaries at a younger age. So these women actually need hormonal therapy if the uterus and the ovaries are removed before 40. And think about what I was talking about the estrogen, because when estrogen is removed, it will also influence the other parts of our body. So also we have to take into account the family history. The age your mother went through menopause is also one of the stronger predictors of when you will be also be going through menopause. So ask her, when was your last menstruation? It's a taboo that sometimes we don't talk about these things, but this is normal. This is nature. This is nature. There's nothing to be scared about. But I understand the feeling. So something to ask. If you don't have it, maybe ask your aunts. If you don't have your mom, I mean. Um, so, for example, if her last menstruation was around her 50s, my mother, I think it was around her 52, that means that I could have symptoms at 42. I was having them before that, but I think my trigger was because of my pregnancy. So, other thing is women that have endometriosis. Endometriosis, it's a disease where the menstruation is really, really painful, and it can be in different organs. Just to explain it really simple. But it's a condition that's also estrogen driven. So during the perimenopause, this transition can become more complex and they may require a different management. So it's important that if you have endometriosis and you're going through this, maybe go to the gynecologist to see what's the best way to manage it. Also, there are some women, they have premature ovarian insufficiency. This means that their hormones significantly change before 40. And this is different than typical perimenopause and really needs specific clinical attention because these women need hormone therapy to prevent the problems with the heart and with the bones and the other and protect our brain, right? So not every woman experienced these hormonal changes the same way. For example, there was a research of Black women that consistently report more and severe and longer lasting vasomotor symptoms. So vasomotor are hot flashes. So this is just one study. So 10 years, they did a research for 10 years, and they looked at there were some factors that were influenced these women, and there was a stress and also the access to healthcare. So this is a research that was done in the US. I can't say that I can just copy paste it to the Caribbean because that's not how research works. But this is what this research told us, that stress plays a big role and how you assess healthcare. Healthcare now, I mean, if I think our healthcare is working really well in the Caribbean, but if you're not aware that you're going through this phase, then getting the right help could be delayed, right? Latina women, they also see higher rates of vasomotor symptoms. And they also see in some research that the socioeconomic stressor and the cultural factors plays a role. So these two things are playing a role with this woman having these symptoms or more symptoms, because there are things that we can do. We think that this is just a phase. No, it's not a phase. It's a phase, but you can do something to feel better, to feel more energized. What we see also in South Asian women, there's a mixed picture. So there are lower rates of symptoms in rural India, but higher in urban settings. So diet, lifestyle, and culture silence all factor in how their women are experiencing these hormonal changes. So East Asian women, they consistently report lower vasomotor symptoms. And one of the things that there was mentioned in this research is the diet, the phytoestrogens, also cultural framing of aging, how they think about aging, and the community structure all contribute that they are feeling better in this phase. So things that play a role in how we are experiencing these hormonal changes are biology, environment, culture, the diet, stress, and how we think about this situation. All of them shape the experience, shape the shift. So let's go to a part that you're becoming, will be more active, your symptoms. So recognizing the pattern in your own body. Remember, this is a guide, this is not a diagnosis. And this exercise gives you a picture of your own pattern. So give it a much, so you can use it as a conversation with your doctor. You can score each symptom with 1, not at all, 2, occasionally, 3, regularly, and 4, affecting my daily life. You find this page on a page, these questionnaires in the workbook in page 13. So you can sign of circle which ones are influence your body at this moment. I will give you 5 minutes just to go through this slowly and to think about how are you standing, and then we will reflect on this, right? So I will give you 5 minutes. Okay, we already did this. So what your score means. 50 plus means strongly consistent. So your symptoms picture is strongly consistent with perimenopause. So this is something that you could bring to your physician and ask them, okay, look, I really feel like this. Can you guide me in this? But this is not a diagnosis. It's a score test. So I use them even with my patient, but this is because I find what you are feeling more important than even a blood test. 8 to 14, so there's a pattern, something is happening, but it really depends on your age, your cycle history, and other factors. And lower than 8, so it's worth exploring what's happening, because of course there are different things happening, right? And then we go back to the mindset connection. So there's this research that shows how Japanese women report significantly fewer symptoms. And what did they see? Diet matters. Your high intake of phytoestrogens, for example, from soy or fermented foods, provides a buffer in them, because we also see that because they are used to eating this food, the bacteria in the gut, we call them the microbiome, is different than ours. And also, what really helped them also is the konenki. So this is the Japanese word for menopause, and it translates closer to renewal energy than loss. A lot of times, Western women, we tend to think, okay, I'm losing something, I'm losing my identity, I'm losing my beauty. But reframing it in another way will also help you to feel better physically and mentally. So I invite you also to reflect, how long have I been feeling this way? What have I tried that wasn't worked? What would I change if these symptoms improve? So for example, if I'm not having the energy what I want to, then what would I do if I was having more energy? What do I think about getting older? This is something that I think we don't think a lot. For me, I have a mirror every day. I see everyday patients that I think, okay, this woman, wow, she really take care of her body. And I see other women where, for example, a woman that smoked a lot, I can see that in their skin. They didn't take care of their body, or that you get a lot of sun exposure. And we also see that when we age. So what do you think about this phase? And this is really something personal. And sometimes it may also be comforting because maybe you are scared. Maybe you have someone that you lost at a young age. And then there are some patterns that we think about it. So it's important for you to know how you think about this phase. And am I afraid of this transition? What does it mean for you? These are questions that you don't need to answer them at this moment. For the ones that don't have the workbook, I invite you to screenshot this because there are questions that can help you when you're journaling to think about this kind of things, right? Because then again, mindset is important. How we think about this transition influence how we experience it. This is not soft advice. This is not just woo-woo or journaling advice. This is neuroscience and stress physiology. This is science, girls. So when aging feels like a threat, failing, losing, ending, we will feel it like failing, losing, ending. And when we held it differently, so we will feel the change and moving through and the beginning of something new. So the feeling will be different. And that feeling will also help you to feel more energized. So now we go to step 3, the full picture, what your body is telling you. And I just want you to invite you in this story. This is a story about a patient that I saw. She was 40 years. She is a mother of 4. This was, I think, 10 years ago. So she's now 50. And she came to me because she had heart palpitations. But otherwise than that, she was healthy. No pain, nothing. Her EKG was normal. So that means her heart structure was fine. She was sent to the cardiologist. We did all the blood tests. Everything was all right. So, but she was sent home with no answer. She was feeling anxious and she didn't know why. And this one is really one of my highlight stories because I missed a patient that was in perimenopause. I didn't recognize it because I wasn't trained for it. I see it now, but I didn't then. I didn't then. And that didn't make me a bad doctor. I was really trying to help her, but if I don't see it, I won't recognize it. And this is what I really like to mention for your physicians. Maybe they don't see it also, and that's why you have the checklist. So what was actually happening with her estrogen affected the cardiac conduction system. So her heart wasn't failing, her body was communicating something. And why this get missed is because palpitations are not recognized as a symptom of perimenopause. And they don't look hormonal from the outside. They look cardiac. And that's what I was thinking, right? Women end up in offices being told they are fine when they are not feeling right. So this is the gap between your tests are normal, but I'm feeling terrible, terrible. And this is exactly why you're here and what I do. Next. So perimenopause is also a metabolic condition. So one of the things that changes is that we become more sensitive to insulin. So your blood sugar becomes less stable. The liver processes fat differently. And that's because sometimes you see around your 40 that even you're eating the same, you're moving the same, your cholesterol or exactly the LDL becomes higher without you changing anything. And also your weight will become higher even without changing anything. The second thing is the inflammation. There's more inflammation in your body. So this will contribute to your joint pain, your tiredness, and your general feeling of feeling low in energy or something else. The third thing is your cardiovascular risk. It becomes higher. And this is most at the end of perimenopause, but it's important to take care of it now. So especially if you have a family with diabetes or problems with the heart, I invite you to take a look at this. And the four is the energy crashes after every meal. So changing cholesterol numbers and post-meal drops in energy. So after your lunch that you don't have the energy and that everything is gone and you can't concentrate anymore. This is not getting older. Sometimes it's not eating well. But it's mostly also the hormones that are influence this part of how we are managing the day and our body. And there's also, this is more about the research part. Women tend to live more than men. Actually, I think we live around 85 years. The question is what is our quality of life? And also, why we live beyond our reproductive years life, right? Because we are reproductive like till our 50, but we live still 40, 35 years. And this is a theory, the grandmother hypothesis, that proposed that women who stop reproducing and invested energy in supporting their grandchildren significantly increased the survival of the group. And this is why menopause is not the end of your biological purpose, but it's the beginning of a new one. And this is a hypothesis. I don't mean that all women after 50, they need to go to take care of the grandchildren, although it will help them to feel better, but that's another thing. But it's more the idea when we look at other mammals, they don't live that longer after their reproductive life. We do. We live 40 years more. So that's almost the half of your life more if you take good care of your health. So this is also to help for your mind, right? That, okay, this is a shift. I still have a purpose in my life. That is what I want to say with this slide. So you're not declining, we are moving into a different role, a different model, a different phase of life. So this is the lab's cheat sheet. You have it in your workbook in page 30. These are some blood tests that I recommend. I'm seeing here that I also missed the hemoglobin. This is the level of how high your blood level should be. But things that I also take into account, this is more from the functional perspective, but also how our body works, is the ferritin. This is how it measures inflammation, but it measures also how much iron you have in your body. Also the fasting insulin. If it's below 8, it's amazing. But if it's higher than 8, then it's a sign that you have insulin resistance. And if it's really high, let's say 20, this could mean that you are in the phase before diabetes. I'm finding each day a lot of patients going through this. So if you have a family with diabetes, that doesn't mean, first of all, that you will get diabetes, but that you are more sensible to it. And like I told you, in perimenopause, our metabolic system changes. So this is one of the things that I really, really, really will recommend to ask your physician to do it. If it's below 8, you're doing amazing. But it's above, then it's something to look into. Your blood sugar levels. A lot of times we just look at 70, 90 in the regular labs. They look for 70, 104. You see it here. But it actually, even if it's already above 100, even if it's normal, that means that your blood sugar level is a little bit high. I also take a look at the HbA1c. This protein tells us how good your sugar was regulated in the last 3 months, and it has to be below this. I tend to look at my patients when I see like it's a little bit high. I control it again, like in 6 months to see how it's developing. Because I like to think about prevention and not act immediately with medicines, because there are things that you can act on before everything gets more dysregulated. Your thyroid is also important, because if you're feeling tired, sometimes it also could be because you have hypothyroidism, and this is also an influence and a hormone that influences your metabolism and your energy levels. So if this one is not working correctly, you may be feeling tired. And why I'm mentioning this is because the tiredness in the perimenopause can also be come together with different things. So the insulin that's fasting insulin that's too high, or that you have a lower iron of. I see a lot of Caribbean women that have myomas, and that they have a lot of bleeding, and that's also pretty common during this phase. If you are bleeding a lot, then you will lower ferritin and also lower hemoglobin levels. And of course, this will cause that we will feel tired. Also, the vitamin D. We live in the Caribbean, ladies, for the ones living in the Caribbean, but I know a lot of patients don't go out a lot, and you don't have to go like sunburn. But even how 30 minutes in the sun after 3 o'clock can help our vitamins level to become higher. And there's a research that shows that when they are really low, they see more women with myomas in their uterus. So, and vitamin D influence so many things. It will also influence your energy levels, how your body is recovering, how your body is fighting infections. So this is also something to take into account. Vitamin B12 is how you're eating. If you're vegan or vegetarian, I will recommend to look into it, that you're eating right, or that you're using a supplement. And even sometimes people that use dairy products and animal products, because vitamin B12 is in animal products. I'm seeing more patients with low vitamin B12. It doesn't mean that you need injections immediately. I always mention start with your nutrition and look at how better that can be. Um, in the workbook, there's a little bit more explanation on this. So the hormone tests during perimenopause are often inconclusive. So sometimes, a lot of times, women come to me and, okay, measure my hormones because I want to know if I'm perimenopause. And then I have to tell them, I don't have a problem to measure them, but it doesn't tell us that much. And that's why I like to look at the quiz that you just did. That can help you more to recognize your symptoms and your pattern, and also how your actions are helping you to feel better. For example, if you do the quiz in a couple of weeks or 2 months, and you see, okay, I did this couple of things and this changed, then it's helping. It can help you to see how things are developing. So the symptom picture is always the primary diagnostic tool. Labs support, and the labs that we saw are the ones that help us see, okay, are other things also playing? Do we need to take other things into account? And they all complete the big picture. And one, because the levels fluctuate too much of the hormone cycle. And if you're using hormone therapy, it doesn't tell you anything because you're measuring the hormones that you're using. So your symptoms are the data, okay? Who's with me? Who did understand this? And you don't need anyone's permission to take them seriously. They're a map. Your body is talking to you. So what are your next 40 years? And this phase, because how I see perimenopause is it's the phase that will define our next 40 years and our future health. So how do you do now shapes what comes next. Now I call it the golden point. For me, perimenopause is the golden point because we still have our hormones protecting our body, helping us. So this is the moment to really dive in. Okay, what can I do better? What can where is something not working? I'm overweight, I'm smoking, I'm not sleeping well. What do I need to feel better and to help my body become better or and keep the energy in my 40s? So in 10 years, probably the golden point is now, right? Like in your 40, 45. So in 10 years, we all will be going in postmenopause. Ladies, let that sink in. In 10 years, we will be in the postmenopause. So we won't have the estrogen anymore to protect our heart and our brain. In 20 years, what we did now, what we ate, how we moved, is what will depend this year, the next 20 years. And our vitality means not exactly living longer, but living well and without illness. This is the moment that we work through that vitality. So to help you visualize this, do you want to be a grandmother or an elderly, if you have kids, but you don't have any kids, an elderly that still have the energy to travel and to keep being independent? Or do you want to maybe just be at home and without a lot of pain on your knees and maybe even with memory problems or diabetes or you name it? This is the moment that we take care of our health. This is the golden point. And what's at stake? This is not to panic, but just to guide you. I was mentioning the cardiovascular risk that we have. So the leading cause of death in postmenopausal women is not cancer, ladies, is the problems with the heart, cardiovascular diseases, because estrogen is a cardioprotective. And the window to build protective habits is now, not later, although we are never late. So even if you're in your 50s, it's never late to start. Or even if you're in 60s or 50s, so, you name it, it's never late. The cognitive decline. Estrogen supports blood flow, reduces inflammation, and influences neurotransmitter that's the ones that send information in your brain. So the brain changes during perimenopause. It doesn't mean that there's some research that shows that we as women tend to have more dementia, but we tend to live longer. And also there's some research that mentions that because of these fluctuation estrogens, that we are more prone to dementia. I wouldn't say that we all need to supplement these hormones, but we really have to dive deep into what's the lifestyle that we need to support to prevent these diseases. That's the basic, even if you want to use hormones for your symptoms. Third thing is that in the next years, in the next 20 years, we have a higher risk of developing osteoporosis. And that's that your bones are more fragile. So if you fall, they can break. So up 20% of bone density can be lost in the first 5 to 7 years after menopause. So bone loss begins during perimenopause also because of the lower estrogens. But there are things that we can do to prevent this. And also the metabolic diseases. So insulin resistance begins here, right? We already saw it. So addressing it now is the difference between managing it early or treating the disease, and that's diabetes or the consequences. So this is not a reason to panic. It's a reason to act. So how do you see myself in the 20 years? So I see myself full of energy running traveling in 20 years. I see myself traveling with my husband and maybe with my kids if they want to, because they will be older, and going to see my grandchildren and taking care of them because that's what makes me happy. So envision how you will like it and what kind of steps you need to take to be there, right? The golden point. So these phases that shapes the next 40 years of your health. It's not being perfect. I'm not perfect. I'm far from perfect. It's about being conscious and deliberate in what actions you are taking. So understanding the biology well enough to make choices that will actually serve you in the next 30 years. To give you an example, a lot of women want to lose weight, the weight that you are gaining because of the hormonal changes, or maybe you had some overweight before. And then they look into Ozempic, that's the injections, the GLP-1s. And you will say, okay, it's healthier because they're losing the weight. But if you lose the muscle, then that can also be a problem. So understanding what's happening with what you're doing, or just to give you another example, we tend to think, okay, I need to eat less to lose the weight. But if you undereat, it will also influence your hormones. So understanding not to the core, but the big picture is important for your 14 for your next 40 years. So in this golden point. So 4 things that I want you to focus on to feel more energized. Not 10, just 4. 1, sleep is everything for our mind, for losing the weight, for to be more clear. So be really careful with it and fight for it that you can sleep enough, like your life depends on it. So sleep is when hormone repair happens. And listen, if you have extreme overweight, and this really depends in how high you are, but I know that if you have it, you know it. Please go see a physician, because there's also a thing like sleep apnea. Then when we have a lot of overweight, that you are not breathing correctly. And this will even influence the quality of your sleep. So maybe you're sleeping the 8 hours, but if you're waking up tired and sleeping during the day, then there's something not matching. So sleep, look that you're getting enough sleep. Second thing is nutrition. Not if you want to lose weight, it's not only about fewer calories, but it's a way of eating that works for your current hormonal reality. And we all know it, a lot of vegetables. I think, at least I hope that you all know it. Eat more vegetables. It's so, so important. Movement, specifically strength training. The research is so strong and consistent for bone, insulin, and mood. Dive into it. How many times a week are you going to do strength training? If you don't like it, start slow. Look for at home or with your body weight exercises. This is something to really dive in. And if you know people, maybe go with some friends. But this is something really, really important to really structure it in your weekly life. The advice is at least 3 times a day, but if you're not used to it, then once a day. But start with something. Mindset. How you think about this transition influence how you experience it. I already talk about this a lot. So this really is a really clinical, honest clinical conversation. Okay, how am I thinking about this? Sometimes it is necessary to go to see a psychologist. There's nothing wrong with that, because our mind is changing, and sometimes we need help to see things in another way. And if that's you, then ask for someone that can guide you through this. So when we fix one of the other, when we fix one, the others will also improve. They are not separate. So how we sleep will influence how you will eat the next day. When you move, you will feel more energized. You will feel more happy. This will also help you with the mindset. In my eyes, it all starts with sleep, then with nutrition, but you start when for you it makes sense. But start with some of them. Perimenopause is not the end of something, it's the starting point. Remember this, it's the starting point of a new phase. So if you have any questions, then we are going on to the Q&A. And for the ones that are here, I'm so glad that you make it to the end of the presentation. I really know that this will help to change your life, to be more aware of the changes that are coming and what you can do. For the ones that don't have the workbook, in the workbook, there is more guidance. And for the ones that have it, please read it through, use the questions, use them to go to the doctor, and use the quiz also to see how the changes are going after changing something in your lifestyle.